It's a pleasure to see you all here today. My name is Ben Lessing. I'm the CEO of Community Care Alliance. We're here to celebrate the 2-year anniversary of 988. 988 has been an enormous success here locally and nationally. Since 2022, nearly 10 million calls have been fielded by 988 programs across the country. Locally, we have fielded over 30,000 calls. And Rhode Island has one of the highest rates of call responses in the country, 98%. We have with us today a distinguished group of guests who I want to just name quickly. First of all, we're very pleased and honored to have Governor Dan McKee here today. Senator Jack Reed. Senator Sheldon Whitehouse. Veterans Director Kasim Yarn. Director Richard LeClaire at BHDDH. Our Horizon Healthcare partners, Dan Kubismeyer, Beth Bixby, Linda Hurley, Dana Gladstein, Lynn Sarah, and Marty Sennett. Kyle Bennett and the team at 211 The Point and United Way. Arthur Martins from 911. Carrie Constant and their team from the American Foundation for Suicide Prevention. And I also want to do a quick shout out to any first responders that may be here. We work with first responders all the time from East Providence, and other parts of the state, so we really appreciate their participation as well. Our first speaker today is going to be Governor McKee. Really honored to have Governor McKee here. He and his team under Secretary Charest at EOHHS have been slowly reshaping the behavioral health system. We're so grateful for their work, particularly around certified community behavioral health clinics and that rollout, which is going to be connected to 988 and other services. So we're happy to have Governor McKee here.
Thank you, Ben. It's great to be here and with my colleagues and Speaker Sakachi, who's an unbelievable partner on these important issues that we address each and every day. So, Speaker, thank you so much for being here. And especially, during this mental health month, it's important to highlight the work happening on a daily basis and the thousands of lives these crisis counselors have fielded. First, I do want to recognize the Center for its commitment to helping keep Rhode Islanders safe. And thank you for all you do. And I have visited the center here more than once, and particularly, pleased to the outreach to our public safety people in the state of Rhode Island. I know the hotlines are buzzing, and the work there to help those first responders, whether our rescue, our police, or a fire, and their families, which is always a connection, because remember, we don't serve alone, our families serve with us. I do want to recognize our Senators Jack Reed, Sheldon Whitehouse. I can tell you that Rhode Island is in a spot that is in a good spot in many ways, so many ways. But their leadership has actually made it possible to do things that we haven't never done in the state. So Senator Reid, Senator Whitehouse, thank you so much for your leadership. Thank you for everyone here championing better health outcomes and mental health support for Rhode Islanders. Last week, Director Yan and our State Office for Veterans Services joined for a mental health day of action, where we outlined supports and resources our state has made available to veterans across Rhode Island, as well as outlets and care available for Rhode Islanders in need. Director Yan led the charge on that, and thank you so much again for your leadership, Director Yan. It was wonderful to hear all the great work happening across our state, and it's wonderful to be here at the call center today to speak with and see firsthand the good people that are doing the work each and every day. And as I've always said, I always am ready to work with the people who are doing the work. And I know that that's happening here. 2 years ago, the national 988 line went live, and since then, this call center in East Providence, as Ben said, has fielded 33,000 calls. And I know that, just think about that. Those are calls from people in need of someone to talk to hear from, to seek encouragement. They might be experiencing emotional distress, substance abuse, suicidal thoughts. For them, it's a moment where they need someone the most. And our call center and these brave counselors have been here just at the right time for them. Timing is everything, and with these 24/7, 365 services, we've helped reach out to Rhode Islanders in need of immediate help and keep them safe. And what better way to strengthen our families, our communities in our state of Rhode Island, but to be helping people when they need that help, so that they can in turn do the same for their neighbors. Some of us may even ourselves have known friends, family, loved ones, colleagues, and neighbors who have struggled with mental health. And as we've said, even in the schools with Commissioner Fonte Green, with a program that was developed coming right out of COVID, it's okay not to be okay. And that message is really important to deliver. It's okay to ask for help, and you should know help is here. So it's okay not to be okay. It's okay to be okay too. That's okay too. These counselors are here, and I'm proud to be the governor of a state and lead a team that prioritizes mental health, works towards better health outcomes for everyone, and is committed to bettering the lives of Rhode Islanders. And what better person could we have than Rick LeClaire to actually lead that charge? So again, thank you to the Center's crisis counselors. Thank you to the CCA, and thank you to Rhode Island for standing up behind those in need of help. Give them a helping hand so that they can give others a helping hand. That's why it works, and that's why I'm so proud of the work that's happening, not only out of our office and our administration, but also in partnership with the Speaker of the General Assembly and the President with the Senate and the House. So thank you so much, and with that, Ben, I'll turn it back to you, and thank you so much for the invitation to be here today.
So I was reminded that I left one very important name off of our list of important people attending here. So my apologies to the Speaker. Speaker Joseph Shikarchi is here with us too. We're so pleased to have him also. Next person I want to introduce is very important to the operation here. She really is the person that oversees the call center and the counselors and provides them with immediate support on a day-to-day basis. Really pleased to introduce our 988 call center manager, Sydney Muraoka.
Hello again. Just gonna pretend that didn't happen. Hi everybody, my name is Sydney. My pronouns are she, her, hers, and I work as the 988 Center Manager at Rhode Island's BH-Link Crisis Center. So I want to thank everybody for coming out today and for supporting our 988 Lifeline. Coming from somebody who works at a crisis call center, it's really cool to actually be able to see everybody's faces rather than to just kind of hear your voices on the other end of a phone call. I've found that working at crisis hotlines, I've developed a new appreciation for the ways that people communicate with one another through their body language. You learn not to take for granted the insights of a gesture or a glance, the way that you can tell somebody's stressed or sad or angry. I'm getting the hang of it, I promise. Thank you, Ben. So you can see stress or sadness or anger through tense shoulders, teary eyes, or a clenched jaw or a furrowed brow. When you have nothing else to go off of but what you can hear over the phone or see as text on a screen, you get really good at listening actively and with intention. And this isn't just something that I knew how to do when I started in this field. You don't just stumble out of bed and into a headset and immediately you're a pro at taking crisis calls. It takes time, dedication, and above all, lots and lots of practice. The team we have in Rhode Island's 988 call center is full of talented crisis counselors who've dedicated their time and energy to becoming skilled at what they do, and with all with the intention of serving their communities through their work on the Lifeline. You'll hear from some incredible leaders and advocates for our state today about the vision of 988 and the importance of this work, but I'm here to offer a little bit of insight on what that looks like and what it means to the counselors that take these calls every day. First of all, no 2 days in the call center are the same. You have to be ready for just about anything. We hear from folks of all ages, whether it be people who are grieving over the loss of a loved one, stress over failing a test, fighting with their partner, falling back into substance use after years of sobriety, feeling guilt over a mistake that hurt someone that they care about, or struggling through a panic attack, and the list just goes on. The circumstances that make a crisis are unique to the individual, but the feelings that come with it are just a bit more universal. I'm pretty sure everyone here can relate to feeling overwhelmed, sad, angry, ashamed, hurt, hopeless, or just some terrible mixture of all of those things. Crisis can feel like you're drowning in impossibly big emotions. But in that moment of crisis is when our counselors are there to throw you a lifeline. When you dial 988, we'll always ask about suicide, but you don't have to be struggling with suicidal thoughts to reach out to us. We partner with the person on the other end of the line and ensure their safety, create a space for them to be heard and feel whatever it is that they're feeling. Help them navigate resources and eventually, and maybe most importantly, offer that person a chance to catch their breath. Our goal in doing so is not to solve all of your problems for just all at once in one phone call. We don't see you as broken or something that needs to be fixed. Instead, we're there to listen. We meet you in a place where you can prioritize your own well-being and see just how much strength that you have, and maybe start to think about a way forward. The way you survive crisis is one step at a time. That might look like coming to the BH-Link for an assessment and referral, reaching out to a friend to get some support after your call, or just making some dinner and putting on a good movie that brings you a little bit of joy. Whatever your path to healing looks like, we have a passion for taking those first steps with you. And despite what I said earlier about every day being different, we have become accustomed to certain phrases or messages from our callers and help seekers. Pretty regularly, people will call and they'll apologize for their crisis. Like say, I'm sorry you have to hear this, or there's plenty of other people that have it worse and who need services more. Too many people think that their struggles are a burden or that they aren't as deserving of kindness and support as others around them. But I promise we've got enough kindness and support to go around. So if you remember nothing else from what I've said today, please just remember this. From the moment you pick up the phone all the way to the close of that call, there is nothing more important to the counselor you're speaking to than your experience. Our team is here 24/7 for exactly this. You didn't choose to feel this way, but when we come to work every day, we're choosing to be here for you. and you're not alone in this. Thank you.
Thank you, Sydney. Now it's my pleasure to introduce Senator Jack Reed. Senator Reed has been a dedicated advocate for suicide prevention and mental health. Because of his leadership, the country transitioned to the 988 Lifeline, advancing efforts to build out our crisis care infrastructure across the country. Senator Reed, it's a pleasure to have you.
Good morning. Let me recognize my colleagues in government that make such a substantial difference in Rhode Island. Governor McKee, thank you. My colleague in the United States Senate and a leader for Rhode Island on so many issues, Senator Sheldon Whitehouse. I also want to recognize all the community agencies that are here. Community Care Alliance, Horizon Healthcare Park, Director Yarn and his team, and also Director LeClaire and his team. They do outstanding work for all of Rhode Island. I also want to especially recognize and thank the crisis counselors who respond to these calls. A phone number is just 3 digits, but these crisis counselors, it's a lifeline. So thank you, thank you, thank you. Several years ago, working with my colleagues in the Senate, we made an incredible intellectual breakthrough. We figured out that 3 numbers were easier to remember than 7 numbers. And that was the impetus to begin the 988 project. I helped write the legislation, get it through, and continue to push for funding. But 988 is, as I said, not just a number, it's a system. You can, in a crisis, contact an expert. You can contact, if you're a veteran, someone who was a veteran also. You can contact someone who has specific knowledge from real experience of your dilemma. With the 30,000 plus calls that you've responded to, just stop a moment and think of the lives you saved. Significant number of lives, and thank you for that. Now, we have to keep up the funding, keep up the support, and continue to improve the responsiveness of our 988 system here in Rhode Island. It makes a huge difference. And in fact, as I often says, it's not just about good policy and good health care. It also is about being more efficient with our resources. Because, you know, someone in a dilemma, they might go to the emergency room, but that's not as good as getting on 988 and getting the help you need directly. So this is very good for all of us. Now, it takes a hard work to get this right. And I am very pleased today to present the citation from the United States Senate to all the 988 crisis counselors. And what I will do is ask Sydney to come forward and accept it on behalf of her colleagues. Thank you very much.
Thank you, Senator. Next, it's my pleasure to introduce Senator Sheldon Whitehouse, who also has been a huge advocate and supporter of expanding mental health services in schools, the elderly across the country, and also providing enhanced services for folks with addictions.
Well, this is a very happy occasion, and it says a lot about Rhode Island that we are where we are. And in particular, it says a lot about Rhode Island that Governor McKee is here to celebrate. Speaker Shekarchi is here to celebrate. Leaders in the General Assembly like Representative Solomon, Representative Shawcross-Smith, former Representative Samini, our directors, Yarn and Leclerc. It actually is significant that all these folks are here. Jack Reed used exactly the right word, which is system. When you are dealing with people who have mental health and addiction issues, you need to reach them with what they need. You need to reach them when they need it, and you need to reach them where they are. And it takes a system to make that work. And we've put a lot of work into this over many years, and I want to commend, for instance, all of the police chiefs who've changed the way their police departments do business to incorporate recovery specialists and social workers into their procedures. We have an entirely new array of addiction engagement and recovery support operational in Rhode Island. We're even standing up a mental health court. We've got the new community behavioral health centers being deployed across the state. There are communities where you can go to a fire station and get immediate access to treatment. And of course, there is the Community Care Alliance, thank you, Ben, that is doing so much to coordinate among all those different efforts. In that developing system, BH Link and 988 coming in are really, really important access points. But I want to encourage us to remember that it really is going to take that system. And while Rhode Island has been, I think, a national leader in building out that system, there's more to be done. There are still people going to emergency departments who shouldn't be there. They should be going to mental health systems rather than waiting 2 days for treatment in an emergency department. There's still people being sucked into the law enforcement and criminal justice system that don't need to be there. So while we have started a beautiful thing and we've made really important steps and we are national leaders, the job is not quite done. So I've been happy to have had a part of this and through the Comprehensive Addiction Recovery Act that we got through the Senate some time ago and into law. Not only the new programs that authorized, but the new funding that followed behind it. And I want to commend Senator Reed for his persistent support for the 988 program and through his appropriations position for the various CARA funding. So thank you all very much. This is a banner day, and it's great to see this turnout for a wonderful, wonderful thing. We are front and center, and we belong there. Thank you.
Thank you, Senator. Next, it's my honor to bring up Speaker of the House, Representative Joseph Shikarchi. I have to tell you that earlier in the year, I attended a Chamber of Commerce breakfast in Lincoln where the Speaker spoke, and at that particular point in time, he was adamant about his support of behavioral health services and about expanding behavioral health services comprehensively. And just this past week, I was at a Homes Rhode Island press conference where he also spoke. And he was very focused on how we help vulnerable people get into housing, get into homes, and that if you think about it from a behavioral health perspective, you know, part of stabilizing people is getting them the basic needs that they require. And the Speaker has obviously been a champion in both of these areas. So it's my honor to bring Speaker Shikarchi up to the mic.
Thank you, Ben. Good morning, everyone. A lot of microphones here today. This must be pretty important. This must be a pretty important event. So thank you for being here. It's always good to be out with my colleagues in government, especially the governor and the congressional delegation and our very talented senators. They're unbelievable. I mean, I've said this before, you know, Rhode Island continues to punch above its weight, and that's because of Jack Reed and Sheldon Whitehouse. They deliver for Rhode Island. It's not because I like them, which I do. It's true. I do like them both very much. It's not because I like them. It's because about the results. And you know, we're talking about mental health today and 988, all these wonderful things, but it takes a village, and nobody can do it alone. And you know, there's so many aspects, there's so many people to look out, so many directors, so many departments. I need to start, of course, with my colleagues in the House, Chairman Joe Solomon, who has led the effort for suicide prevention for many years and made sure there was funding in our last 2 budgets for that. Mary Ann Shawcross-Smith, representative from Lincoln, who continues to push forward on mental health issues and the most vulnerable and daycare issues. We care about so many people. There's so many needs. There's never enough. But it takes a village. It takes a village of people on every single level. We've done so much. We're going to continue to do so much. I just want to talk about just a couple of brief things from the State House perspective. 5 years ago, 6 years ago, I don't remember the exact date, this guy came and see me, and I didn't know who he was. His name was Rich Leclerc, and he came to see me. He says, I have an idea for a bill. I was the majority leader at the time. Mr. Leader, he says to me. I said, all right, well, what's the bill do? And he says it's called mental first aid mental health. And I said, okay, does any other state do it? He said, nope. I said, you want me to champion a bill, an idea that's never been done? He said, yep. And so began a journey where in 1 year, we created a bill and a program, and I fought a lot of people to get it done, and there were a lot of people who supported me, but nobody supported me more than Rich Leclerc, and he did a phenomenal job, and I don't forget that. And we won a national award. It's called First Aid Mental Health. And what this program does, and it's in vogue now, and everyone loves it, we're the leader in the country in it, but it trained policemen who show up in the scene where someone is in crisis to understand if that person needed mental health or he needed police attention. The actual rank and file police love that. Some of the older policemen and the administrator and the chiefs didn't like it so much. But now the program has come into effect, and Rhode Island's leading the nation, and we have won, the state of Rhode Island has won a national award. So Richard, thank you. Governor made a good choice in selecting you. We continue to do that. And since my speakership, we created a mental health court. Actually, technically, it's a mental health calendar, because we need it in Rhode Island. Because people sometimes don't need to go into the prison system, the incarceration system. They need to go in the mental health system. And we've recognized that. We've made allocations of that. We've appointed a special court for that. And we want to make sure that people who need mental health treatment get mental health treatment and don't become incarcerated, because that just spirals out of control. It's a wonderful facility. I took a tour earlier, and what people were talking about, the way they described it to me was so unique. It said that we are an air traffic control for people who need mental health services. We get them to the right place, whether it's treatment, whether it's to a doctor, whether it's to a counselor, whether it's to community health, whatever they need. This is a air traffic control place to get the right people to the right places. Doesn't happen without federal funding from Jack Reed and Sheldon Whitehouse. So gentlemen, thank you once again for everything. And in conclusion, about mental health. Mental health is just not about what you see today as far as a person in crisis, either a homeless person or a person in need. That's just a part of it. We're dealing with this at the State House. We have our public safety officers, our firemen, and our policemen who witnessed some very traumatic events. And we have legislation pending, and I am working hard to make that legislation a reality. It's PTSD for our public safety commissioners, and I'm working with the League of Cities and Towns to get their support, because that's the only way you get things done, is by bringing people together to get things done. Thank you very much for this wonderful recognition of this 2-year. I hope to come back here 2 more years from now as well. Thank you very much.
Thank you, Mr. Speaker. Now it's my pleasure to introduce Katie Anderson. Katie is our Vice President of Acute Services here at Community Care Alliance. Katie's going to give you an overall picture of what the comprehensive continuum of care looks like and why these services really are life and death resources, if you will. Katie?
Good morning. Thank you, Ben, for the introduction. Thank you to all of my fellow speakers and for all of you for being here today. Your support means so much. Again, my name is Katie Anderson. I'm the Vice President of Acute Services for Community Care Alliance. My agency proudly staffs the 988 call center and the BH Link Triage Center. You've heard a great deal already about 988 and how our call center is leading the nation with its answer rates. I'm here to tell you about how 988 is so much more than just a call center. The 988 vision nationally is that it is both a place to call and a place to go for those seeking services, resources, and crisis support. Once again, in this regard, Rhode Island is leading the way. We operate an in-person, 24/7 walk-in mental health and substance use triage center called the BH Link right here in the same space as 988. BH Link is an interdisciplinary treatment team made up of clinicians, prescribers, nurses, and more, all of whom support the call center's crisis counselors with particularly complex or high-risk calls. 988 callers are offered the opportunity to come into BH Link for face-to-face assessment and care, regardless of insurance and with options for transportation. All clients who come into BH Link are offered a safety and risk assessment and a behavioral health assessment. They're given behavioral health appointments, resources, or immediate and direct placement in inpatient or residential settings, depending on their needs and goals. The data tells the story. BH Link diverts over 85% of its clients away from hospitals and emergency departments to less restrictive, less costly levels of care. 988 has resolved over 95% of its calls without need for public safety intervention. We also give follow-up calls to our highest risk callers to check in and offer additional support or resources, with over 2,000 follow-up calls to date to ensure ongoing wellness and safety. Together, BH Link and 988 save lives. They operate jointly as our state's behavioral health care hub, as the speaker said, like an air traffic control, helping clients in crisis or in need of treatment navigate a complex statewide behavioral health care system with ease. It's my true honor to support these programs, and I thank you all again for being here today.
Thank you, Katie. Just can't say enough how proud we are of the work that Katie is doing and her team here at 988 and BH Link. Our next speaker is Director Kasim Yarn. Director Yarn is the Chief of Veterans Affairs here in the state. He's worked hard to remove stigma from behavioral health services. I also have to say I have a bit of gratitude for Director Yarn being here, in part because not only from his position, but about a year and a half ago, we did a fundraiser to raise emergency funds specifically for clients in needs. All of these funds went directly to clients, particularly those folks that were in crisis. Director Yarn helped us with that, showed up, spent an evening with us, helped us raise $30,000. And so I'm pleased to have Director Yarn.
Good afternoon, everyone. Thank you all for being here. It sends the right message to all the Rhode Islanders across this beloved ocean state of ours. People always ask me, what's the source of my motivation? Because I love my ocean state. I love it for our size. The speaker said that we fight above our weight. But it's bigger than that also. Because look around it. Just take the time just to look at the beautiful people that are here together. Different communities, different organizations, champion the cause. That we live in a different world now, rightfully so. But we have an ability to learn from our past, to not repeat the same mistakes over and over again. This is our civic duty, to advocate for others, to be there, to do our due diligence, to be honest with the taxpayer. But that takes leadership. That takes courage. I'm a humble man. I'm only one individual. But when we work together, there's nothing we can't accomplish. Our governor talks about it being one team. The speaker talked about using all 39 cities and towns working together. We understand the important role that our congressional delegation has for us. But it doesn't stop there. It starts at the grassroots level. To our community providers that are here today, thank you for your leadership. Thank you for willing to get dirty. Because we know that in order to move the needle, the stigma around getting help, mental health, behavioral health, the overall wellness, we're making a difference. Just by dialing that number, 988. It's making a difference in our community. I'm a firm believer that when we are talking about being a steward for the taxpayer, data should drive policy. Our data from the 988 program is making a difference. It validates the hard work that our congressional delegation sat down and crafted this legislation. It's that same data that we're using at our level. Topeka, where our congressional, they started the process, now our state can pick up the ball and we're running with it. And we're not taking the foot off the gas around behavioral health. We're not taking the foot off the gas around advocating for those that can't advocate for themselves. We're not taking the foot off the gas when it comes to identify the needs that impact all of us. All of us making these decisions, working together. So this is truly a celebration. Someone called it maybe a victory lap, but it's a champagne of efforts around behavioral health because we can do it, and we are doing the work. And that's a testament that we are doing the work while we're all here together working as one team. We know we're going to have some differences. That's what families do. We have dinners around, we have those discussions. But you know what, at the end of the day, we're better from the long run because all of us play a critical role. To my colleagues in state government that are here with us, I always say, we say it collectively. You can tell a lot about a state, how we handle and approach the work for our youth, those that are living in poverty, our aging adults here in Rhode Island, and of course, certainly last but not least, our veterans. Our veterans. Utilizing the system, making it easier for access for those to take that step towards recovery, taking that step towards getting some assistance. And sometimes it's going to take all of us to help that person when they can't take that step. That means I have to take 2 further steps closer to that individual to share myself, to share my stories. Because when you start to share your stories, it adds the human component to what we do. When you share your story, it's like, you know what? We're all the same, regardless of the zip code where we live. And our children to be educated as a result of that as well. Our elderly aging population has a role in its impact. Those living in poverty, there's a calling and there's a special blessing for those that care for those. We all can do it. We're all working together. And lastly, for all of us here, we can also do a better job at loving ourselves. Looking in that mirror and being comfortable with the person you are. And if you're not comfortable with that person that you're looking at yourself in the mirror, okay, so what do we do with this information? Take those steps. And if you can't take those steps, well, there's a number that we can call. And we all know the number. And it's just the 3 digits, 988. It's just as easy. God bless you. I love you. Take care.
Thank you, Director. So I want to introduce Director Rich LeClaire. Rich and I first met in 1981 at the Northern Rhode Island Community Mental Health Center in Woonsocket. And those were heady days in some respects because we were in the midst of building a system. And to Senator Reed's point and Senator Whitehouse's point, how important systems are in terms of being able to respond to people quickly where they are, and give them the least restrictive treatment and resources that we have available to them. Rich went on to become the Executive Director of Community Counseling Center and eventually the CEO of Gateway Health, and also has served in many capacities, Governor's Council and other national committees as well. So it's my pleasure to introduce Director Rich LeClaire. Rich?
Thank you, Ben. Thank you and your staff, especially Sydney and Stacy and everyone that worked for you at the 988 call center and at BH Link for all the work you do every single day. That's where you make the difference, and we're all proud of you. So thank you. Thank you, Governor McKee, Speaker Sirkachi, Senator Reed, Senator Whitehouse, Director Yarn, Director Samini, Interim Director Stacy Fisher, Representative Solomon, yes, Representative Shawcross Smith. Thank you for being here, for the work you do every single day to help the mental health and well-being of all Rhode Islanders. We appreciate everyone here today to get this important message out to our families, our neighbors, our friends, and our colleagues. We cannot state this enough. 988 is here for everyone who needs mental health assistance. 988 was created so that everyone who needs help can reach out by simply calling those three numbers. And you're right, Senator Reed, 3 is better than 7. So 988 provides assistance every single day. Since this was launched in July of 22, Rhode Island Call Center has answered more than 12,000 calls solely on the 988 number, and over 33,000 when you add it to the BH Link contact line. That's more than 600 calls a day, 600 calls a month from the BH Link line, and 100 of those are on average veterans. That's in addition to 200 calls a month that are made to follow up on those initial calls and to make sure someone seeking help gets the right sources. The Rhode Island Call Center is answered 98% of the time that it's routed there, consistently achieving the best, if not one of the very best call rates in the nation. Another matter to be very proud of here in Rhode Island. So this is all good. It's great. It's fantastic. And it's amazing. But even with all this activity, and even with the Lifeline up and running, there are still some folks who don't know about it, particularly older folks. This is why we need everyone to spread the word. The survey last fall by the Department of Behavioral Health, Developmental Disabilities, and Hospitals found that 63% of Rhode Islanders know about 988. While this is a pretty good number, 37%, or more than a third, do not know about 988, so therefore can't access it when they need to. That means we have more work to do. As you all know, May is Mental Health Month, and there's no better way to spread the word about 988. We all know somebody who's experiencing a mental health issue. Fortunately, calling 988 is free, it's confidential, and people are at the other end to help you. We must all remember 988
and tell all our friends to remember. Once they dial it, they will be quickly connected to caring professionals on Sydney's team and Stacy's team to assist them. So today, we thank our elected officials who made 988 a reality, and BH Link staff who handle the hard calls, the hard work, and do that hard work every single day, and who are enthusiastically backing this particular endeavor. Before we unveil the new campaign, we ask you one favor: to spread the word about 988. The campaign is illustrated on these two black cards here, that there will be advertising on buses and on billboards throughout Rhode Island starting this summer, and it'll go on for several months. So I welcome you to come up here and view this information after the speaking is done. It's a new effort to get the word out about 988 so someone does not have to suffer in silence or deal with problems that should be more easily resolved by some of the resources we can provide them. So please come up here, take a look at this information, and again, spread the word. It's a pleasure being here today, and thank you so much. Ben, I turn it over to you.
Thank you, Rich. Want to thank and recognize Blue Cross Blue Shield Rhode Island for sponsoring this event, which I think has been very successful. Next, we're going to take some questions from the press, and I'm available. Katie Anderson or Sydney will be available as well if there are any specific questions. Okay, we'll do that one-on-one. We'll be up here. So again, I want to thank you all for coming out today. We really appreciate it. Pleased that the weather cooperated for once. But one of the last things I would ask you to do is, if you're curious about 988, call 988. I think you will find a very caring but also sophisticated process in terms of the response, and you will be quite pleased. But again, thank you all so much for coming out today.